Hello, my name is Linda Wynn, and I am in BSN 246. I will be performing the skill of inserting an IV and discontinuing an IV. The things that you need for this particular skill will be gloves, tourniquet, you'll need a catheter, and in this case I'm using a 20 gauge 1-inch needle. I have 0.9% sodium chloride, IV extension, some alcohol, some gauze, some tape, and I'll also have one of these to go ahead and apply on top of the catheter. So we begin with going over the healthcare provider's orders. After I gather all my supplies, I go into the room, knock the door. Hello, my name is Linda. I am your nurse today. I have orders here to start an IV. May I have your name and date of birth? Patient's then going to go ahead and say their name, date of birth. I'm going to go ahead and check their band, and that right there is me confirming patient's identity. Once I have that, I'm going to go ahead and explain to the patient why I'm doing it. And in this case, patient is an elderly lady who is here in the ER because she's dehydrated. So once I've explained everything and I've received and I have all my things laid out, I'm going to go ahead and perform hand hygiene. I'm going to go ahead, perform hand hygiene, put on my gloves. Okay. Now, this piece that I have here is a little bit smaller than the other pieces that I've seen other patients, or not patients, but students have. So I'm just gonna pretend it's a little bit bigger. So I'm gonna go ahead and apply my tourniquet, and I want to apply it 4 to 6 inches above where I'm gonna go ahead and insert my catheter. This is a small piece, but let's just pretend, okay? So 4 to 6 inches. Okay, proposed insertion site is about 4 fingers. Okay, so we're about down here. So once I have that done, I'm gonna go ahead, grab my alcohol, and I'm gonna start inward out in a circular motion. Discard that. I'm gonna go ahead and feel for a distal pulse. If I feel one, then the tourniquet is not on too tight. If I don't feel one, then it is too tight. Okay. The other thing you want to do when that is happening, or you might want to do before, is make sure that you prime your line. And the reason you do that is because you want to not insert any air into the patient's vein. Okay. All right. So we'll begin. It's already clean. I'm going to grab my catheter here. Again, this is a 20 gauge, 1 inch. I'm going to go ahead and anchor the vein that I'm going to go into. So I'm going to go ahead and pull against where I'm going to insert. And I'm going to go in at a 3-degree angle, bevel up, insert. Okay, I see some flashback. Once I know that I'm in the vein, I'm going to go ahead and insert another 1/4 inch in. Then I'm going to go ahead and pull forward the catheter here. Okay, once I do that, I remove the needle, and then I'm supposed to push this to retract the needle. But because this is my last needle, I'm going to pretend that I'm going to retract it, and I'm going to dispose of it in the sharp container. So click, it's in the sharp container. Then immediately I'm going to go ahead, take this off. Okay. I see the flashback. I'm going to go pull back, and then I'm going to go ahead and just insert, or just squeeze it in. Okay. Like this. And the reason that we do this is because we want to make sure that we're still in the vein. Okay, once we're in, I'm going to go ahead and clamp this. Remove my tourniquet. Okay. Now, with my other hand, I'm going to grab this and I'm going to add the tape. Because this is my last one, I'm going to pretend that I'm going to go ahead and place it right over here like this. I've already put my initials, the date. One thing I didn't do is put the time. So we'll put the time. And then I'll put the number, I put the size of the gauge, which is 20. So this is gonna go here. We're gonna pretend I'm taking it off and then placing it right here. Not above the whole thing, but just where that little, there's like a little groove or line thing that is on here. Okay, so once this is on like this, I'm gonna go ahead and disconnect this. So this is on there. And because this piece is not big enough, we're gonna pretend that I'm just gonna go ahead and kind of loop it over here, pretending this is, you know, the patient's arm still. And then grab my tape. And then just tape it again, pretending that this is still part of the arm. Remove the tourniquet. Okay. Like that. Okay. All right. Then when I'm done, I'm going to go ahead and remove my gloves. And then I'm going to go ahead and, perform hand hygiene. Okay? Then I come back in, knock on the door. Hello, my name is Linda. I'm your nurse again. Can you go ahead and give your name, date? Again, they're going to tell me their name and their birth date. Confirming again that this indeed is the same patient and it's my patient identifier. I have orders now today to go ahead and remove your IV. So I'm going to go ahead and perform hand hygiene. And I'm going to place my gloves on once again. Okay. Then I'm going to go ahead and it's kind of hard because it's not really on, but I'm going to go ahead and remove carefully the this big piece of, I'm not even sure what this is called, like a covering the catheter. Then I'm going to go ahead and once that's done, I'm going to go ahead and take my tape off here as well. Okay, discard. I'm going to grab a piece of gauze. So now this is off after I've removed it. And I'm going to quickly and gently remove the catheter and then apply pressure for 30 seconds until the bleeding has stopped. This right here, I'm going to go ahead and put in the sharp container. After about 30 seconds, I'm going to get another clean piece of gauze, replace it. And then with another piece of tape, there you go, add pressure. And then after that, take off my gloves, remove all my items, things that I use, perform hand hygiene, and that's it. Thank you.